Good day. Yes. Okay, and so let's take a look at your dialysis activity. Okay, and so dialysis. For this, accordingly, your dialysis, this is the process of separating molecules in solution by the difference in the rates of diffusion through a semi-permeable membrane. Okay, and so in the activity, we utilize your solutions of sodium chloride and starch solution. We placed it in a cellophane. We tied it, making sure that it will not leak, and placed it in a beaker that contains distilled water. Okay, and so after that, we set it aside and let it stand for 1 hour. And then after that, we tested for the contents of the the contents present in the cellophane and present in the dialysate. Okay, and so but then before that, let's take a look at the application of your dialysis accordingly. In to chemistry and medicine in general, your dialysis is utilized as a separation technique for removing unwanted compounds from macromolecules. Okay, and so this one is important in removing impurities like in your drugs accordingly. Okay, and so this one is a crude separation technique. Okay, and yes, your dialysis accordingly follows the principle of diffusion. Okay, and so your diffusion again, this one is the movement of your solute from an area of higher concentration of solute to an area of lower concentration of solute. Again, in diffusion, the ones that will move here is your solutes, not the solvent. Okay, and so that is in diffusion. Okay, and so again, we utilized your sample, your starch solution and sodium chloride solution. These ones are placed inside the cellophane. And yes, after 1 hour of standing, we tested for what is present inside the cellophane and what is present outside the cellophane or what is present in the dialysate. Okay. And so we tested the fluid inside the cellophane. Okay. And so for the expected results of this one, your cellophane, the fluid inside the cellophane will contain sodium chloride solutes, sodium chloride, and starch. Okay, and so for the expected result here, your fluid inside the cellophane will contain starch and sodium chloride. Okay, and so we tested first your presence of your sodium chloride here. Your sample, of course, the sample, 1 ml of sample is placed in a test tube. And then after placing that, we added drops of concentrated nitric acid and silver nitrate solution. Okay, and so we gently mixed, and of course, the expected result here is a production of white precipitates. Okay, and so production of white precipitates indicate that there is a presence of sodium chloride. Okay, and yes, the fluid inside the cellophane contains, should contain, or it contains sodium chloride. Okay. And then after that, we tested also for the presence of starch with the use of Lugol's iodine. Okay. And so in the procedure, we placed 1 ml of fluid from the cellophane, 1 ml of fluid or 1 ml of fluid from the cellophane, and then after that we added drops of Lugol's iodine. And again, the fluid inside the cellophane should have or should give a positive result for this one because your starch solution will remain inside the cellophane. It cannot cross the semi-permeable membrane. Okay, and so supposed to be you will have a result of a production of a blue-black color, or in case, since this is a solution, there is a production of black precipitates. There should be a production of black precipitates. Okay, and so that will indicate the presence of starch in the solution. Okay, Again, and so for the fluid inside the cellophane, you have here the presence of sodium chloride and starch. Okay, and then yes, let's move on to test the fluid outside the cellophane or the dialysate. Okay, and so testing the dialysate, we tested your dialysate, 1 ml of sample, and then added drops of concentrated nitric acid, and then 1 ml of silver nitrate. Okay, and so, and the expected result, there are precipitates, white precipitates produced. Okay, and so please note that your please note that your sodium chloride solutes or sodium chloride molecules, they are capable of crossing the semi-permeable membrane, the cellophane. Okay, and so they are smaller, they can cross the semi-permeable membrane. That is why they are present in the dialysate. Okay, and so again, your expected result here is a production of white precipitates, indicating that there is the presence of sodium chloride molecules. And then, yes, we also tested for the presence of starch in the dialysate with the use of Lugol's iodine. Okay, and so 1 ml of sample, we added Lugol's iodine, 1 ml of dialysate, and then drops of Lugol's iodine. And then the expected result here, there is no precipitates. There should be no precipitates produced. Okay, and so because the idea again here is that your starch solution cannot cross the cellophane, that is your semi-permeable membrane, that is why it should not be present outside the cellophane. It should not be present in the dialysate accordingly. With this, your expected result, there is a production of brown color without precipitates. Kinulayan lang po siya ng Lugol's iodine. Okay, and so the brown color is just imparted by the color of your Lugol's iodine. Okay, again in the dialysate or in the fluid outside of the cellophane, there it should test negative for starch, the presence of starch. Okay. Okay, so with that, let's take a look at your colloids versus your crystalloids. Your colloids, these are homogeneous, non-crystalline, large molecules that are suspended in a solution. Okay, and so that is why if you did observe your starch solution, okay, and so the starch molecules settles at the bottom. If they are not disturbed, the starch solution will settle at the bottom. Okay, and so examples of your colloids aside from starch. Well, of course, your starch is a colloid. Other than your starch, you have your albumin, your dextran, and then your gelatin. Okay, and then your crystalloids. These are solutions of salts and minerals that can be crystallized accordingly. And so please note that the main difference accordingly of your colloids and your crystalloids is your size. Being your colloids, they are larger, and your crystalloids, they are smaller. Okay, examples of crystalloids, you have your normal saline solution, 5% so 5% dextrose, and the rest. Okay, and so again, that is for your colloids and your crystalloids. Okay, and so answering the question in your activity, what is the colloid in the activity utilized in the activity? You have the starch solution. What is the crystalloid utilized in the activity? You have your sodium chloride solution. Okay. And then, yes, let's move on to your dialysis accordingly. Okay, and so this one, your hemodialysis and peritoneal dialysis is important. These are actually medical procedures that is important to filter waste, salts, and fluid from the blood once your kidney dysfunctions. Okay, and so this is done in cases of kidney failure. Okay, and so also aside from filtering waste, salts, and fluid from the blood, this one's also help control blood pressure and balance important minerals accordingly. Okay, and yes.